Hi, and welcome to the Opioid Overdose Prevention and Naloxone Training. My name is Lauren Johnson. I am the Community Engagement Facilitator on the Healing Community Study here at the Prevention Council of Putnam. Today's training will be a very short training teaching you how to use your naloxone kit. If you'd like some more information on the prevention and harm reduction activities of the Prevention Council, I encourage you to log on to our website at www.preventioncouncilputnam.org. All right. So today's training has 3 learning objectives. The first is to understand the opioid crisis occurring locally and across the United States, to learn how to identify and respond to an opioid overdose, and to learn how to administer your naloxone kit. Within Putnam County in 2021, we saw 66 reported overdoses. We know that that number could be much higher than that, but those are the reported numbers. 11 of those overdoses were fatal, and then 50 of those had naloxone administration. So that's 50 lives that were saved by administering naloxone. So as a reminder, naloxone is a medication that can work to reverse an opioid overdose. So when it's administered, it can reverse the effects of an opioid and start an individual back onto normal respiration, normal heart rate, so it can reverse opioid overdose. So we see here in Putnam County, 50 reported, again, only reported administrations of naloxone to where they were able to reverse an opioid overdose and save a life. So what are opioids? Opioids are natural or synthetic substances that act on the brain and the central nervous system. Some opioids may be prescribed for pain or they can be misused. So we have prescription opioids that are prescribed usually by a medical provider, but then there's also other naturally occurring substances such as heroin or other substances that can be bought more illicitly. Opioids are used to relieve pain. So most often they are a prescribed substance that are used to relieve pain. They're risky because anyone exposed to opioids may be at risk to become dependent or misuse them. Opioids have a high risk of overdose. So depending on what type of opioid we're looking at, especially with some high potency synthetic opioids like fentanyl, they do have a high risk of overdose because of their high potency. An overdose occurs when the opioids overwhelm the receptors in the brain. So an opioid goes into the body, however it enters the body, whether it's orally or injected, and that goes up to the brain and occupies receptors within the brain, and it does help to reduce pain, but when it is overused, misused, or accidentally overused, then it can cause symptoms like a depression in respiration. So the breathing is suppressed. A person may stop breathing altogether. Overdose usually occurs within 1 to 3 hours. It's faster for fentanyl or the synthetic opioid, high potency opioids that we talked about. It can be caused by taking more opioids than prescribed. So if an individual is prescribed opioids for pain, if they take more, whether it's accidentally or misusing or intentional, it can result in overdose. Combining opioids with other depressants such as alcohol. So if an individual is also taking something that is slowing the central nervous system functions down and adds the opioid, that can have what we call a synergistic effect. Or 1 + 1 doesn't necessarily equal 2. 1 drink plus 1 opioid pill doesn't always necessarily equal 2 servings. It can be a lot more than that, and it can really depress breathing or heart rate to a dangerous level. Taking more opioids than one can tolerate. So if somebody is taking them at the same rate as somebody who uses them more often or has a different tolerance, that can result in an overdose. So what are the signs of an opioid overdose? So usually a person will be unconscious or be barely conscious. So it can be very difficult to wake that individual up. They may seem very sleepy. Oftentimes when I have discovered an individual who is in the process of overdose, they make a snoring sound, a really deep gargling snoring sound. And that's, again, because the respiration is depressed. It could be coughing, gargling, snoring sounds, but often it's this really deep kind of snore type sound. Their pupils would be extremely small. Again, if you have access to looking at them, their skin may be cold and clammy to the touch. Very often we see discoloration. For lighter colored skin people, it may look blue. Their lips and extremities may appear a little bit blue. For darker skinned individuals, that may be kind of ashen or light white type coloring in their lips and their extremities. One may feel disoriented or dizzy. And the breathing, like we said, if there's not snoring, it may be completely absent or really, really low and shallow. So why are we using naloxone? Why is that a good answer? Why are we passing them out to our general community members? And the answer is pretty simple. Naloxone is effective. Naloxone reverses the effects of an opioid overdose. Anyone in New York State can be trained to administer naloxone. So anyone, whether or not you have clinical background or work in a helping profession, if you're just somebody who would like to carry because on your daily commute, you see people who you suspect are using opioids, or maybe somebody in your community is using opioids and you'd like to be prepared in case of an emergency. It's an incredibly effective way, accessible way for us to help reverse opioid overdose. Secondly, naloxone is safe. There is no potential for misuse or addiction. It is non-toxic as water. The great thing about it is if you do suspect that somebody is overdosing, but you're not quite sure, and you administer naloxone, there's an extremely low likelihood that the individual will have an adverse reaction to that. So even if the person is having a different kind of medical emergency, maybe it's a cardiac emergency or a diabetic emergency, something like that, but you're not quite sure, it's not going to hurt them. So if you administer naloxone, you're not sure if it's an opioid overdose, it's actually something else, it has an extremely low likelihood of hurting that individual. But if it is an opioid overdose, you can save a life. So that is why the Good Samaritan law, which we'll talk about in a minute here, covers individuals who are administering naloxone because it is such a safe substance to administer. It will not hurt somebody who has not taken opioids. So even if somebody had taken opioids, it's not going to hurt them. It's only going to help them. So the Good Samaritan law in New York State says that anybody who is acting in good faith, administering naloxone to try and reverse an opioid overdose, that they cannot come into any trouble. The law protects you, that you're not going to be sued or penalized or anything like that. So as long as you're acting in good faith. There's a couple of very small exceptions to that, which I listed on this slide here, mainly pertaining to individuals who have a felony, who are taking part in another criminal act at the time that they're administering naloxone. So never in my career have I ever heard of anybody falling into this exception. Usually individuals are covered by the Good Samaritan law. So we'll continue and talk about that a little bit more after this. So right now there are two ways to administer naloxone. There's the injectable version and the nasal naloxone version. Lucky for us, when I was working in clinical work a couple of years back, we were using the injectable, and that can be very intimidating. But now we are administering the intranasal naloxone, which you see pictured here and in my hand. It's extremely easy to use. You don't have to remove anybody's clothing to inject them or worry about anything like that. You just need access to the nasal passages to administer it. So it's very easy, not very intimidating at all. Okay, so now we're going to walk through what it looks like when you approach an overdose and how you administer your naloxone. So first, you may come upon a situation where you see somebody who is unresponsive. So meeting some of those criteria that we talked about that you'll see in an overdose. So maybe they're unresponsive, they're very lowly responsive. They have the discoloration, they're breathing funny, maybe making that snoring sound. Sometimes you'll see somebody either slumped over and kind of making that snoring sound. We call that nodding out. An individual may be on the floor. So you walk into a situation, and if you don't know the individual's name, you can just kind of shout. But what you first want to do is you want to try some verbal stimulation, and you want to be really loud because you really want to try and wake that person up. So if you walk in, you know the individual's name, you can use the name. If you don't, you can say, hey, 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 are you okay? Are you okay? Hey, are you okay? So you're really trying to wake that person up. So shouting, if you know their name, hey, Lauren, are you okay? So if they're not responding to that very loud verbal stimulation, you can move on to step 2, which is physical stimulation. So you can use what's called a sternal rub. You take your 2 knuckles, your index finger in your middle, and you take those knuckles there and you rub it on the individual's sternum, right on their chest here, on that sternum bone right there. Do a really good rub to try and physically stimulate them. You can at the same time do verbal stimulation. So we're rubbing, hey, Lauren, are you okay? Lauren, are you okay? So again, if your verbal stimulation is not working, now your physical stimulation is not working, you can go ahead and assume that the individual is overdosing and prepared to administer your naloxone. Step 3, you'll want to tell somebody to call 911. If nobody is there and you don't have quick access to your phone to call 911 yourself, go ahead and administer the naloxone before you call 911, because you don't want to slow up getting that life-saving medication to that individual to call 911. So you're directing somebody to call 911, grabbing your phone really quick to call 911, but if you can't get to your phone and you don't have anybody around, go ahead and administer the naloxone, and then we'll go ahead and call 911 right after we do that. So we have done our verbal stimulation, we've done our physical stimulation, we have directed somebody to call 911 or call 911 ourselves, or we've made a mental note to do that right after we administer our naloxone. Step 4 is to go ahead and administer that naloxone. So in each one of your kits today that you'll be getting either today or in the mail, however you're accessing this training, they are blue kits right here, and you have 2 of these naloxone doses in your kit. You'll want to keep both doses in there, and I'll tell you why in just a second here. It's very easy to open up. At the back, there is a metal casing here. So you pull that back, and then you get your naloxone dose out here. You'll take your index finger on one, your middle finger on the other, and your thumb on the plunger. You do not want to prime this or push a little bit to see if it comes out. This medication comes out in one pump. So please don't prime it like you would maybe a different naloxone or a nasal spray. So you'll approach the individual. If they're laying on their back, you'll want to prop their head up so you have good access to their nasal passages. If they're sitting in a chair and you can't safely get them on the ground, then you'll want to just prop their head back in that chair, and you'll stand behind the individual to administer this naloxone. The reason for that is if an individual is overdosing on opioids and they're a habitual user, they use quite frequently, chronic user, when you put this in their nose, it will throw them into withdrawals, and they may be very uncomfortable when they're waking up. So maybe their arms will flail, their legs will fail, maybe they'll sit up really quickly. So you want to make sure that you're going to be able to be clear of that. So you'll stand behind the individual, you'll insert this into their nostril, and you'll give it one good plunge right into one nostril there. And then you'll step back. Now, in all the times that I've administered naloxone, it happens very quickly, where in 30 to 60 seconds, the individual starts to kind of wake up. And it, again, like I said, it's a miracle. However, if the individual does not wake up in 1 to 3 minutes, you'll grab your second dose of naloxone out of your blue kit. You'll open that up and you can administer it into the other nostril or the same nostril. It doesn't matter. If you do remember which nostril it was, go ahead and put it in the other nostril. You'll stand behind the individual again. Your pointer finger on one, your middle finger on the other, your thumb on the plunger, insert it deep into the nostril, and you'll administer that second dose, and again, stand back. Now, if the individual does respond, does wake up and become conscious, you'll want to tell the individual, hey, you know, I just administered naloxone. I thought you might have had an opioid overdose. I've called 911. They're on their way. You're safe. You know, give us a couple minutes. Help will be here soon. You might feel really uncomfortable. That's to be expected. Help is on the way. So, you know, reassuring them, letting them know that you administered naloxone, and kind of reassuring them that they may feel really gross right now, but help is on the way. Now, if an individual does not respond to the naloxone, you can do one of two things. If you are trained in rescue breathing, you can begin rescue breathing or CPR at the time. If you are not trained in rescue breathing, or you don't feel comfortable or safe doing that, and you've already called 911, you're waiting for your first responder, you can go ahead and lay that individual in a rest position. So that is flat on the floor, rolled over to their side, one arm draped over, their leg draped over the other side, so that they're laying on their side. And the purpose of that is if the individual does get sick and vomits, if they're laying flat on their back, like you've just administered the naloxone with them flat on their back, if they do vomit, they can't aspirate on that vomit. So we want to go ahead and put them to the side with their arm and their legs draped over them so that they are in a safe position. Hopefully your first responders are arriving at this time after your 1 to 3 minutes after you have administered your naloxone. We know our Putnam first responders have very good response time, so hopefully help is there to help you if there is another medical emergency going on, or if the individual requires more naloxone, which can happen. In my experience, I've never had to administer that second dose of naloxone myself. I've seen it happen, but most often your one dose will be helpful. You are equipped with 2 doses in your kit, but sometimes in rare cases, you will have to administer more naloxone to see the effects of that. So this is just an extra way of explaining how to give the naloxone spray. You'll peel the back tab off like we talked about. You'll peel that off. You don't want to do this beforehand. You want to wait until you're in the moment of needing it, peeling that back off. You'll place the device into one nostril and you'll press the plunger firmly. Again, you don't want to prime it or just see if it comes out a little bit. You'll want to insert that into the person's nostril and firmly plunge into there. All right, remember, you do not need to remove their clothing to administer nasal naloxone. This was an obstacle sometimes with administering injectable naloxone, having to find a good place to get that to enter the body. That is not needed. If a person does have a face covering because of COVID, you may need to remove their face covering in order to access their nasal passages. So you'll probably just want to remove that mask altogether. If the first dose does not work within 2 to 3 minutes, you can give a second dose and begin rescue breathing again. The guidance on this varies between 1 to 3 and 2 to 3 minutes. But go ahead and try and take note when you give the first dose, you know, what time it is, how long it's been, so that you can go ahead and administer the second dose if needed. If the person is still unresponsive, make sure that you lay them in the recovery position on the side to prevent choking and wait for help. Again, if the individual is seated when you discover them or in a different position where you cannot safely get them on the ground, that's okay. We don't want to risk you or the individual for you getting them on the ground. But try to get them in a safe enough position to be able to get clear access to their nasal passage to administer the naloxone. Reminder again, after the administration, you want to stay with the person as long as you can or until help arrives. If the person is still unresponsive, you lay them in the recovery position. You can explain to them what has happened, like we discussed. The person may start experiencing really uncomfortable withdrawal symptoms. So, you know, empathizing with them that they may be really uncomfortable, but help is on the way. Try and comfort that person. You know, they are going to probably be feeling pretty uncomfortable. And so trying to just let them know it's okay, help is on the way. I'm happy to stay here with you until help gets here. So after you use your naloxone, you'll want to call the prevention council to get your new kit. You can, when help arrives, they may ask you how much of naloxone did you administer? You can tell them I administered 1 dose or 2 doses. You can kind of show them the kits that you administered. They are pretty standard, 4 milligrams per dose. It doesn't really vary. They don't come in different strengths, so that should be pretty apparent to the first responders who arrive. But after you use it, we are providing you with a detail kit as well. This is a safe disposal kit that you could put your used naloxone kit in. These are used for any medications to deactivate the medications. In these little bags, there is a specialized carbon element. You can add whatever medications you're using. In this case, we're encouraging you to put your used naloxone kits in here with a little bit of water. You seal the bag up, it has a little zip top, and then you can throw that away right into your trash. This deactivates any medication that is left in the naloxone, so it doesn't get into the groundwater or anything like that. This is a pretty safe substance, but we also want to be responsible when we're disposing of any pharmaceutical or any substance. So this is a great way to safely do that. So we're going to include that in the kits that you receive from this training. This is a great resource. So if you have any other medication you're trying to safely dispose of, namely any opioids that you have expired or you're not using anymore, this is a great way to deactivate those medications and dispose of them in a safe way. So if you have more questions, please contact the Prevention Council. You have our phone number here, 845-225-4646. You can always catch one of us here at the Prevention Council. Let us know that you need a new kit because you've used yours, and we'll happily get you another free kit. And that's the end of the presentation here today. Again, my name is Lauren Johnson. If anybody has any questions, you can go ahead and give our phone number a call or visit our website. I'm very excited that you took the training here today. Thank you so much for taking this step and keeping our community safe. And we look forward to you getting your naloxone kit. Thank you.